Hello, hello. Happy Tuesday. We are live from Innate Healthcare Institute. I am Dr. Miriam. We have the lovely Cece. Today. Beer finger. We're excited to be here today. We got some exciting topics. And a big topic. So we're gonna, talk about other things for a little bit, but we are gonna be talking about just as people, load in and come into the, what can we call it? To like our arena, our live arena. Like a room. Our room's normal, but arena's more fun. Well, for those of you who are more my age, it used to be a thing. At AOL, like the rooms you used to like go into like have conversations with people. It wasn't the way it is now, but
oh no, I remember
anybody in my age will.
But also, I'm not aging myself, so I have no idea what that.
I'm in my 40s. I don't really care. 43. I mean, come on.
I'm a mystery. Mystic creature, if you will.
So welcome to all of you who are coming in live. Welcome. Thank you for joining us on this Tuesday live. Let us know. Drop in the chat. Let us know where you're coming in from. And what questions you have. So if you have questions that you are curious to get the answers to, we will do our best to answer it. We do have a topic for today, and it is on the what seems to be at this moment a catchphrase, a hot topic, if you will, that is regression. I'm gonna put that in quote unquote regression. Yeah, we'll get into that. On post-stem cell therapy. And I say a hot topic because we can always tell what is trending either on social media or what is trending in your like autism family groups, your feeds, right? The information you're getting. We can tell what's trending because we start to have a lot of parents ask us very similar questions. So regression is our hot topic of the day. It is sizzling right now, and we're going to talk about it.
San Diego.
Hi, Corinne. Thank you for joining us from San Diego. Our weather is probably much like yours, right? We walk outside today, and it is a little bit sprinkly and cool, and I think that very much is reminiscent of San Diego, which I love San Diego.
I'm an Arizona kid, though, so if I yawn, it's not personal. The gloomy weather just takes me right out.
Oh, it is calming her.
Oh.
And then I'll probably yawn because,
I'm
not a psychopath. So that, yeah, that's what they say.
So now if you don't yawn, though, everyone knows.
That's the thing. That's there. If you yawn, you're not a psychopath. It's empathy. When somebody else yawns, you yawn. Pay attention, guys. I just gave you a little nugget.
Oh, man, the things we learned.
Yeah. Angie, Northern...
Listening from the hot
tub. Who said they're on the hot tub? We're listening from the... Oh, he said, look at you guys. You guys are here right now and in the hot tub. And wanting some clarification. I am. Yeah. So, Erin from Scottsdale. Thank you. Corinne. All right. So let's do... And difference... effect between the two. Yeah, okay. I'm just trying to go between the questions. Just gonna step out with she odds.
I can't.
Okay, so I'm gonna answer these quickly so we can get onto our little topic. But in response to Alexandra, your question, the biggest difference in why we use the different methods that we do is that intramuscular, the cells will stay in that area and they will replicate for longer. When you use IV, they do spread throughout the body and they go toward directly to where the body is calling for healing. And so they're both good. They're both useful. It is, in your specific case, it's just, do we want to do another stick or not? And so I think Becca responded to your email, but that is the difference. There is no clinically significant, like, if you have the chance between an IV and an IM, you really must do one or the other. It, it's, we want to make sure we're getting every method at some point, which we already are. And so now it's just, we've already done the other two methods. So now it's just one more of one way or the other. Not one is better than the other. It's just how we have ours set up to do 2 days of intramuscular, 1 day of IV, and then every day, half of it, the other half of the cells intranasal. For those of you who are new to our clinic or are watching this, the way we do our method of delivery, we always do 300 million stem cells. Those 300 million stem cells are either done in 2 days or 3 days. 3 days if the kiddo is under 60 pounds, 2 days if they are over 60 pounds. If we're doing in 3 days, then they're going to get every single day, or even 2 days. So every single day, 50% of cells are going intranasally. We are trying to access the sphenopalatine ganglion. That is a bundle of nerves that come from the brain, protrude through the back of the skull, in the back of the nasal passage. When we access those nerves, the cells will attach to and travel back to the brain, and that's how we access the brain without having to go intrathecally. So that is why we use the nose. The other methods, then, if you're a 2-dayer, you're going to get 1 day a shot in the arm, 1 day an IV push. So it's not an IV that hangs and drips, it's a push. We have cells in a syringe, we access the vein, we push the cells, pull the whole thing out. If you're a 3-dayer, you've 1 extra day. So we just chose to do intramuscular. Likely guessing the reason behind is just that they will sit there and replicate a little bit longer. But it's not to say that one method is better than the other, and like there's that much of a difference that if you don't follow exactly, it is still an experimental therapy, that there are no hard fast rules. So at that point, it's just preference for her specific situation. Otherwise, we do exactly what we do. We just follow how we do it because that works. And so at that point, it's just what you guys want to do based on tomorrow's visit. So I hope that helps. Of course. Yeah. So there was another. Okay. What does an initial first ever visit look like, Corinne? On your initial visit, you will come to the office about 15-30 minutes early, and fill out paperwork, finish the financials for your first day. That's why we ask that you come early so you can finish those things. You will have gotten in your email a survey that is part of what Miss Cece does. It's called Benchmark in their email. And so we ask that you fill that out a week ahead or within that week before, because that helps so that she can go through it faster with you, explain anything that's necessary, or just kind of verify with you the first day. So when you come in your first day, you will, depending on whose schedule you are on, you will see either the provider first or you will see Cece first. We will get a baseline at some point during your visit of where your kiddo is at. It's just to track where they started and, subsequent months where they are going. There is nothing else that we are tracking. It's just each kiddo subjectively. And so then you'll come in, you'll talk to the provider or Cece. And on different days, it just looks different. We do answer all your questions. Our staff, Becca and Jack, go in. They'll explain testing if you're getting a testing option, if you have that in your package. And then we prep cells only when you are here and when we are ready for you to get your cells. So they are prepped immediately prior to giving them. And then once they're done, we give them to you. So your first day, if you're coming a little early, in the space with us, it's just an hour. So it's technically like an hour, 15, hour and a half. Your first day, the second day is an hour. The third day, if you're coming for a third day, tends to be more toward like 30 minutes, just because you've gone through, your visit.
And 30 people have been talks to.
Yeah. And so, most kiddos by that day anyways, they're like, I don't even want to be here. So get me in and out.
They're fine though. Some of them on third day are like, oh, it's okay. I'll get through it.
Because they understand, right? And I understand what's happening. So there's a little bit less. And some are not, and it's okay. We get it. We're a doctor's office. Nobody wants to be here. So that tends to be what it looks like. And then we will follow up with you afterwards. So Cece follows up at 1 week and then 1 month.
Yeah. I follow up a lot. Okay, well, there's stuff going on, then I will continue to follow up as well. But you will also get the survey at different intervals as well. So there's a lot of follow-up going on.
And Cece also does spend time in whatever part of, because it looks a little different whether you're on Dr. Ashley's schedule or my schedule as to what days she goes in, because she has to split her time. So she will do a day of doing the survey or reviewing it with you, and then 1 day of going over. Well, you can explain what your day looks like.
Yeah, yeah. And then, so first day, we're kind of getting a baseline. We're going over whatever's going on with the survey, kind of just making sure it's really accurate. And I have a good idea of where we're starting off with your kid. And then the second day, I come back and we actually do a full consultation where I sit and discuss with you what kind of goals you have for your child. What do we want to make sure that we're implementing to get to those goals? Answer any questions you guys have about behavior or what the likelihood of communication is and how we work on that, step 1, step 2, etc. Those kind of things.
Yeah. And so that's actually a perfect lead in. We have some more questions coming forward. The Cedar, I hope I pronounced your name right. I know you were here last week, and thank you for being here. You were in from Dallas. Oh, Saucy. Perfect. Thank you. In from Dallas. Good to see you again. So I want to, let me see. Bo, hello. Welcome. Angie. Okay, so let's go back up here. We have a couple things coming through. Bo, 17, multiple disabilities. Okay. Dysphagia, has a G2, chronic lung disease, stem cell treatment, help, or healthcare institute. So here's what I'm gonna say, Bo. I appreciate your question. There's multiple factors going on for your son. And I think what's important to understand about stem cells, it's the same thing I tell our parents for autism or some of the kiddos that we see for cerebral palsy. The cells are healing, or also known as medicinal cells. So healing cells. They're going to go in the body. They're going to flood the system with these healing cells, and they're going to improve areas that have dysfunction. Whether they're, not connecting well in the brain, whether in the body there's sources of inflammation, and that's not allowing the cells to communicate well. Like whatever it is that the body...
Red flag.
The red flag, because the body is sending out these signals, these red flags that say, hey, pay attention. I need attention over here. So as soon as the cells go in, they're honing to where the body is calling for the greatest need. And so what I can say is we know that they are going to be healing aspects of your kiddo, healing things in the body. We don't know what that looks like on the outside. We don't know if you're going to see things on the outside that are going to show what that healing looks like on the inside. And that's where each kiddo, it is very subjective, because each kid's underlying reason, autism or not, chronic disease, multiple factors or not, every kid is different. And so that's why, we never guarantee an outcome. We can say in the world of autism that we do regularly, we know these typical things are going to be seen. After 1 session, this is common. After 2 sessions, this is common. Never guaranteed, but common across, many families. The degree of it is also different. Even though it's common, how much you see it.
Right. When are we starting? What's going on? What other factors are at?
Right. What behaviors?
Yeah. There's so much that goes into it. There's no way for us to give like a straight blueprint of what's going to go on.
So when we look at someone like your kiddo that has multiple factors, I would say if the question is, can it help? Yes. Can I give you how it's going to help? No. I can say that from a safety standpoint, the cells are very safe. Like they are medicinal or healing cells. They are similar to what we have in our body already, in that we have stem cells. That's what our body uses to heal us. We're just, super saturating the system to try and get greater outcomes, and doing it multiple times, because then you're really allowing the body time and greater ability to heal over that time, because you consistently are giving more cells over time and allowing for healing. So could you see some improvements even in the similar things that we see with our kiddos? Because we've had some cerebral palsy cases, and we have had parents tell us, they start noticing the attention, the eye contact, like following gazes, those kinds of things, a little more awareness. So I can say those are very common, and so you might see those. But I can't go beyond that to say what else you might see. But I can say that because of the safety profile in them, the biggest side effect we have is low-grade fever, directly from the infusion of the cells. Outside of that, you might notice in the weeks after some of that hyperactivity I've talked about in the past, which is going to lead into our topic today. That is them trying to adjust to their increasing awareness. And so you might see the same thing in your kiddo, like agitation, irritation, those kinds of things in the first 2 to 3 weeks. 4 to 6 is the longest we typically see. And so beyond that, then we know at some point it's going to help. We just don't know what that's going to look like. So if you're willing to come in with that open mindset and say, let's just see what happens, without expectation of something specifically happening, then we can say, yes, like it'll likely help in some area, but I don't know what that's going to look like. So I hope that answers for you, because we do have kids that come in with, if they've been tested, they do have translocations or deletions or things in their genetic profile, and it does nothing for that. But it can potentially help with some of the some of the symptoms that are happening because of that, genetic challenge or genetic issue. So it's like a yes and. So yes, there's potential can help, and I don't know what that's going to look like. So I hope that helps you understand a little bit better. And I would say that you can always, as with anybody else, you can call the front office 602-603-3118. And option 1 gets you to scheduling as a new patient, and they will put you on Dr. Ashley or my schedule, or even Dr. Hazel's. Since yours is a bit more of a chronic, multiple chronicities, overlapping, multiple things there. But that's how you start, is a consultation, and it's a 30-minute consult. It's $150. The cost does go toward treatment if you opt for treatment, or if you opt for therapy. We don't call it treatment because we're not trying to treat something. It's more of a therapy where we're having to do multiple sessions to get improvements in something. So we do steer away from the word treatment because we're not directly trying to treat anything. So I hope that helps. And then Angie, is there a way to know if MSCs come from a COVID vaccinated person? Another hot topic. Yeah, the cords we're using currently are not COVID vaccinated. COVID actually didn't exist at the time. Well, it existed, but it didn't exist in our pandemic world. So it's a no. They are not COVID vaccinated. Sassy, we will get a certificate or report of the cells that are being given to the child during the visit. We are scheduled for mid-July. Sassy, there is not a certificate or report. If you wanted something like to see the batch flow cytometer results, we could provide you that. If you want to see the batch sterility report, looking at, viruses, bacteria, things like that, making sure that the sample is void of any of those, we're happy to provide that. If you want, the biggest thing we could give you is a viability report, which we would do at the very time that we thaw your kiddo's cells. We would take a small aliquot, 10 microliters, so it's just a tiny bit, but it is of your kiddo's cells. So as long as you understand that we're taking from their aliquot, or from their cell volume, we can take that and put it under our microscope that will read the viability and give you a percentage. And that is possible before any infusion of cells. So that can be done. And we would just give you the percentage at that point as to how many were viable. Viability meaning we froze it, we thawed it, how many are alive and viable. And so that is always possible, but there's no other certificate or anything that is given. Erin, you're scheduled for November. Are we still seeing positive outcomes with, I'm sorry, you're scheduled for August. Your son is
11 and a half, but you still see positive outcomes.
Oh, yeah.
Mm-hmm. Absolutely.
Yeah. Cece can touch on this a little more, but it's something I often say. It's not that the cells stop working the older they get. The cells will always work.
It has more to do with where your child is at in terms of behavioral patterns, right? What are we used to doing for that long in our life that's going to be harder for us to change, okay? So if you have a kid who has a lot of behaviors and things, there's definitely things that we need to address to be able to ensure that we are getting a different expression from them when we increase their cognitive function.
And so you can keep talking while I drink more.
Oh, I was going to stop, but just bring it up. You know me, I like you the queen. But yeah, so there's absolutely things. I will discuss with you if you're scheduled for August. We'll sit down and we'll have like a very in-depth conversation about what you're hoping to see with stem cell therapy and kind of look at how we're working with things now. And basically help you figure out ways to make sure that we are making the stem cells be able to do the things that we want to see them do when it comes to things like behavior, understanding that if we're wanting some form of verbal communication, we have to understand the concept of communication before we can sit and just say, hey, where are our words at, right? So I help teach that and help you figure out what we need to increase and decrease to be able to get the most potential for a child to start using verbal communication. But, it really depends on where your child is at 11 and a half, and we'll pick that apart.
Yeah. And so that's the biggest thing with the older kiddos is they have ingrained ways of doing the things that they do.
We do. I think we get really stuck in this mind frame of someone on the spectrum, right?
Right.
We're people too, right? We have ways that we do things. If you mess up my morning routine, I feel frazzled. There's all sorts of things that are just human aspects, right? And we start to look at them through these like microscopes because it's somebody on the spectrum. But a lot of it is just understanding that this is a kid, this is an 11-and-a-half-year-old. How do we help them learn something? How do we help them build skills? How do we help them change bad habits? Those are kind of the things that we're kind of digging into with them.
And the stem cells are collapsing that time frame, right? So that's where the stem cells come in, is that they're not going to change the behavior for you. I think that's a common misconception is I'm going to do this thing and my kid's behavior is going to change. They're going to communicate better. They're going to do all these.
Yeah.
No.
We get a lot of, we wouldn't have this behavior if they could verbally communicate is one of the most common things I sit down and hear from people. And it's like, well, unfortunately, reality of that is that they're used to communicating via that behavior. It is nonverbal communication. A child who is acting out, has a tantrum, having some form of behavior is often a child who's trying to tell you something, right? And we have to work with that.
Yeah. And so the cells, what we see as that foundational improvement that the cells are allowing for, the increased neural network connections, the increased communication of the cells, we see that something that might have taken a kiddo experiencing autism weeks to months to years to actually learn that skill, we're collapsing that time frame because now they're having, even after one session, greater attention, focus, eye contact, so that they can actually stop.
Yeah.
And see what it is you want them to do.
And we help teach you how to motivate that too.
Yeah.
That's the other piece, right? So we have to motivate this out of kids. Kids are kids.
Amen. Mm-hmm. I got a 6-year-old child.
Yeah, I mean, children don't necessarily want to learn their skills, and they don't want to do chores, and they don't want to do things we ask them. They don't want to eat their broccoli. These are all things that children do, right? So we sit and we work with the idea of, okay, well, what can you as a family do to help your kiddo actually work on doing those things while utilizing the gift of stem cell therapy in the process, if you will.
Yeah. Yes. And so that is the biggest thing that we see is we collapse that timeline and they can pick up those things a lot sooner and easier. And so also then on that topic is this idea that, after you do stem cell therapy, we get a lot of parents that are like, oh, well, I noticed this and that happening, but I don't know if it was stem cells because we were already working on that. And it's well, it probably came faster because you were already working on it. And they were within their own mind working on trying to understand that topic.
It's like we connect the dots for them.
We just finalize
that there and the dots are slowly connecting. You can consider stem cell therapy being bink.
Yeah. And then it all flows. But I don't know if it was stem cells.
Yeah. Yeah. And I've worked with a lot of older kids on the spectrum too, and I can assure you that without the right things in place, it is likely that a lot of behaviors and things will not change, even though that kid could be possible or could be capable.
So let's go into regression because this is exactly on our topic. Here's a hot button issue.
Yeah, let's go.
Let's talk about regression because we get some various and I mean we're laughing and having fun with it, but I really want parents to understand that when you do stem cells, we understand it within the groups that people are bringing up this idea of, oh, stem cell caused my kiddo to act more poorly, to have greater behaviors. So they're regressing from their baseline. That is not the case. The stem cells will not cause regression. Look at the very nature of the stem cell. They are healing cells. They are medicinal cells. They are going into the body and they're healing areas. So what is actually happening? The first thing I say is, it's the analogy I always use that I think gives parents a little bit of a visual. When you do stem cells, if you look at your kiddo right now, assume that their awareness is that they're standing in a house and all they can see is there's a hallway in front of them. They don't see the rest of the house. All of a sudden, when we do stem cells, they see the whole house. What was there before, they now see. That is overwhelming. So the first thing you will notice is them trying to adjust to this awareness that they're like, whoa, what is all this? Like, it's always been here, but they've never seen it. So you're looking at them going, this has always been here, but they just never seen it. So now they see it. And so what you will notice in the 2 to 3 weeks, potentially 4 to 6 weeks post-therapy, is you will notice whatever they do in their communication, whatever they do that soothes them,
We might see more.
you're going to see more of.
We might. There are some kids that do not have this. And I always like, it's like rare. Yeah. Sorry, but that's rare. You probably do not hear about it as much as I do to be there. Well, but a lot of this is personality too. You have to understand. Some kids are just like, oh, okay, if you have a child who's a little more introverted and isn't maybe trying to express quite as much, then they might not go through these expressions, right?
Sure.
Whereas if we have a extroverted child, a child who's very used to attention seeking, a child who, is used to kind of functioning via behavior, you're going to see most likely a little bit of an uptick in this. I will say it does often level itself out.
It does.
Make everyone hearing from out there don't this topic before we get too much into it. I'd like to make sure people understand it often levels itself out. We have to make sure that we're doing what we need to be doing to make sure we don't perpetuate that as a way of expression or communication, right? So again, that's what I help with. That's just get sticky in that situation. But it's nothing to be concerned about or worried about. And I always want people to understand that if you even see an increase in behavior, realistically what we're learning is that your child is not regressing. Your child is trying to further express. Your child is trying to get your attention more. Your child is intrigued by things they were never intrigued with. Your child is feeling feelings they hadn't felt. So maybe we're stimming a little bit more because of that. These are all things that are actually a sign that things are going in the right direction. It's our job to be able to help them to direct that in a way where they learn the things they need to learn through that process, right? So how do we build skills? How do we work on our verbal communication? How do we deal with our emotional regulation and all those things?
Yeah. And so there's the 2 to 3 weeks after where most people will notice a heightened sense of these emotions. And then it'll come down for most kids. I've rarely had a parent say it lasts longer than the 4 to 6 weeks.
Yeah.
But then there are going to be what is the new normal. It is what we've talked about before, where it's, hey, they have a red crayon and now I see that red crayon. Yes, it's always been there, but now I actually want it. So now there's temper tantrums, meltdowns. Now there's behaviors of them having new awarenesses.
And again, kids.
Cute. I mean,
Kids. These guys here, even just kids on the spectrum. This is kids in general, right?
Kids in general.
And I think it's really important, again, we get the community gets very kind of picky party about this kind of stuff. And at the end of the day, it's this is reactions from children that we get all the time. It's just
neurotypical or not.
Exactly.
It's kids being kids.
Right. And it's a matter of learning, how do we work with that, right? Your kiddo on the spectrum is going to be probably a little more stubborn, kind of give you a harder time. Their reactions to things are absolutely going to be a little more exponential, right? But how do we work with that? And we absolutely can work with that. And I think that that's the most important thing that I want people to take away from this, is that after that, we can have a whole better outcome for a kid, right? Once we work through that, we're now in a place where a child is more regulated. They're motivated to communicate. They're calmer. They're more focused. But we have to help them learn those things, particularly if we're working with a child who is having those kind of exponential expressions, if you will.
Can we give an example? Without naming Nakim. Which one? Without naming names, the one that we'd recently been talking about, who came in with some of the behaviors were spitting, were, not wanting to walk or be in a stroller, some of those things that are make things very challenging. So without identifying, we're going to kind of just go through how it starts and where it can get to.
Yeah. I mean, you want me to
just kind of a little bit of the progression
so we started in a situation where it was difficult, okay, for family, for kiddo. We weren't walking on our own. We had a lot of issues with eloping. We had a lot of self-stimulating behaviors, a lot going on. It was a bit overwhelming, very hyperactive, not doing any form of direction following, anything like that. I worked very heavily with this family to be able to get them to a completely different place. And
they were willing, right? I mean, that's part of it. Is I think sometimes, Cece has this unique way of looking at and understanding kiddos on the spectrum. And so although, yes, so many of you are doing ABA, it can be helpful. And there's just some kids that don't respond. If you don't get a great therapist, as with anything else, it can be more challenging.
Program, yeah.
Right.
As implementation, someone will just make decisions. They're like, what are you guys doing?
Right.
Okay.
And so parents sometimes get a little taken back because they're like, that's not what I've been told. So the things that she is educating parents on, it really takes it. We're just giving you tips, right? She's giving you insights and tips on how to do things, but you get to go home and decide, are we going to implement this? Are we going to follow through or not?
Yeah, a lot of it's understanding your kid, right?
Yeah.
So a lot of, what happens is I think oftentimes parents get told, do this, don't do this, and they're not really getting the understanding of the child. So when they're up against something that maybe didn't have a clear do or don't do this, then we make the wrong decision and then we perpetuate behavior or do something that's problematic, right? I want you to walk away from our conversations with an understanding of how your child functions, how they learn, how they build skills, how they're communicating. I want you to be able to feel like you have the tools that you need to leave and be able to do what you can for your child to help optimize stem cell therapy.
Which then when we start seeing these, changes in behavior, these increases in awareness, maybe more meltdowns and things like that, because they're having the greater awareness, greater things that they're making choices that they didn't realize they could before, that they're noticing how they can
buttons. We could push buttons.
Yeah, because every kiddo knows whose button to push. They're kids. They're so smart. They get it. So they know what buttons push mom, what buttons push dad.
They know who to go to for what, just like any other child. They know, oh, mom will allow this and dad will not. I'm going to mom.
Right. And so it's no different. It's just that potentially before we did the cells, they were so in their own world, they weren't seeing these things. And now they are. So if it gives you any sort of, puts you at ease at all, just understand a lot of this is just new behaviors from a child being a child and expressing themselves as a child that has greater expression, that has greater feelings, that has, greater awareness. And so it's just understand the dynamics. I know. Are going to change. And so I think if you come into stem cell therapy, understanding that is an underlying part of what is going to change within your family, I think it makes it easier to step back and go, oh, okay.
Yeah.
This is not regressive behavior. This is just a change.
Yeah.
And you're going to see a change. What you're not going to come into cells to do therapy and your kid's going to be exactly the same as when you left and only doing the things that you want them to do.
Right.
They're going to evolve as a child. They're going to evolve as a person.
It's the same way everyone else does.
Yeah.
That's important to understand.
And the idea of when their form of communication is already challenging, when they're already having the behaviors of, hitting others, pulling hair, scratching, self-harm, they are going to get more aware. And that is the behavior that you will likely see increase. If they don't know how to, have calm time or quiet time, how to know how you quiet time, calm body. Yeah. Then, and they have hyperactive behaviors already. They don't want to be in this hyperactive constant meal.
And I say to Amelia, something I want people to understand a lot is that, sometimes these kiddos have never had an opportunity to learn how to calm their nervous system. A lot of these kids are running at a heightened state all the time. And if that's all you're used to, how are you supposed to learn to come down from that, right? And it doesn't feel good to them. You can tell. You can watch your child get heightened and overstimulated. All you need to do is give them an iPad and see what they do when they're scrubbing back and forth. You can watch them get overstimulated. Doesn't feel good to them. We need to teach them that, though. And I think it's important, again, it's a skill to remember that we are adults learning that too. We have to learn to put our phones down. We have to learn to get off our computers. You know, we're doing the same kind of thing, except they're a kid and they need a little bit more help from us, you know. And I think that that's kind of the end.
And they're capable.
And they're
so
capable. Like, I don't think that I have had a family that did not do work with me and do the things that we had suggested. That did not do my stuff. Just we have the mirrorniest lives. I don't think I have a family that I can muster up in my mind that did not see improvements in all of those places when we actually implemented the things that we needed to, when we started believing in kiddo being able, right? We want to enable your child to do more. We want your kid to build skills. We want them to learn things. We want to look at your goals and we want to get as close to those as we possibly can. And it's something it's really doable.
But it is because we see it.
Yeah.
And we talk this way because we see the kids that come in that are like,
I have like 10 emails a day that's just somebody updating me on something cool. Different families updating me on cool things that they're seeing, stuff that they worked on that worked. You know, it's awesome. It's a really, really awesome thing. And it's really, I feel very grateful to be able to watch this many people with so many children see these changes for the kids and the families themselves.
And so that's what's happening with the stem cells. It is A, the stem cells are not going to change their behavior. They're going to make it easier for you to work with them. And B, it is not causing regression. And so if it helps to post this video in all your autism groups, go for it. Because it's important to understand, because not only that, what did we say earlier? We are scaring parents away from doing something that could very much help their kid.
And that's the part that I want this video out there for.
Because they don't understand. And that, I think, is one of the biggest things that sets our office apart, is that we have the behavioral component. So I get it, and I empathize with parents that are going to clinics where they're just like, here's some cells, right, see, got it out. Yeah, figure it out yourself. Because it could be challenging when you're saying you don't
understand that, you don't know that. And I mean, in all fairness, that's something that I've been studying and learning about now through Innate for 5 years, right? So it's not something that you can assume anyone can figure out and just understand and, you know, do on their own. But we're here for that. You know, we're here to support you. We've been learning about it. We do understand what's going on. You know, I have a lot of background working with kids and adults on the spectrum. So it's like I can't think of anything yet that I haven't heard. If you have something that I haven't heard, please let me know, because I'm curious. But I've seen it all. I've heard it all. I've worked with it all, hands-on myself. And, you know, I want to be able to give that back to people and families and kids. And that's what we're here to do. With stem cells, we also want to support you in all that.
Yeah. And so that's why this was our hot topic of regression, because it's not really that. And I think just that informing parents and what to expect, informing you of, you know, take a step back and look at this as the whole picture and how can we work with your kiddo. I think that helped people understand, like, oh, it's not actually regression, it's just changes. And so that was the whole point of this, because then you're focusing on it and you're looking for the thing that says this is regression, right? Instead of this is just my child expanding and changing and like, oh, how fun, challenging, but fun. That's kids.
Yeah.
My child had a screaming meltdown in the car yesterday. And so, you know,
they do that stuff. Yeah. They do it. That's good.
That's what they do. We got to school. She was out of it like this. So, a little different, but just to say, like, let's just look at this as the whole picture. This is not regression. This is not a negative thing. It's just expansion. It's change. And for any of us, it's hard. Kiddos on the spectrum or off the spectrum. Like, it does not matter. So I hope that helps calm some fears and allay some fears a bit. And let's see what questions we have now. Yes, Bo, I love that. Looking for all the avenues to give your child the best chance. Totally understand that. And so I hope that was helpful. Thank you for your question.
Oh, that's us.
And that's Bruce. You're on it. What does Bruce say, Bruce? He put a link there. Expectations to have after receiving stem cells. Thank you, sir. Schedule consultation. Look at that. Say he's on it. So good. Bruce. Okay, thank you for explaining. Of course, Cece's voice is a little less audible. Oh, darn it. Well, That's all
It
right.
might be because I hide in the back. That's my
Yeah. What have been your positive outcomes for osteoarthritis, Christine? That is a fantastic question. Not one I am really in alignment with because I don't know, but I don't know if alignment is the right word, but privy to. I would say, Christine, I would love for you. I will say this. I know that there are a lot of people that have gotten improvements from it. It's sometimes not just one visit. It can take a couple, just like with any of our other things that we're working on. But I know of stories where people have had like osteoarthritis in the knees, in the hips, in different joints, and they've had great outcomes. I would recommend that you go to our website. There are tons of testimonials, and osteoarthritis is so common that I would say you're likely going to find a couple videos of people that had that issue, and you can find their testimonials. So that's what I would say from that standpoint. Alexandra, slide off topic to you.
So innate gear, like sweatshirts or t-shirts.
Oh, it's sweet. Good.
Yeah.
Yeah. Huddle tomorrow. No, we have a huddle every Wednesday where we have these conversations.
Yep.
I think that's a fantastic idea. We do have bags that we had at one point.
We do have.
I think we went through them so fast.
Yeah.
So we need to get some new things. But
Yeah.
wonderful idea. We're gonna
Love that.
yes. Kabim, apart from stem cell therapy, what other therapy do you provide, especially for patients with cerebral palsy? We don't have any other therapies that we provide for CP or for even our kiddos with autism outside of testing. So gut microbiome, the toxin test to look at heavy metals, molds, environmental toxins, which still, I would still recommend that. Because in all honesty, a lot of the exposure to toxins are actually coming from in utero. They're coming from mom and mom's mom and mom's mom. Everything, these toxins get held in our system. And then when when babies are in utero, our blood supply is exchanging with theirs. And I had some thought around this happening. I've looked up, there's not a ton of research. There's not a ton of research on women and pregnant women, much less. But I have had enough kids come through. They're like 2 and 3 and 4, and they have these extraordinary levels of exposure, 30, 40, 50 different exposures. And I'm like, there's no way this is coming from them and their exposure. And I have started, having some parents test here as well, and then finding overlap and find they have a lot of exposure. And so it makes sense. So a lot of this is also coming from mom. So no blame, just awareness that toxins are holding in our system and we are passing them. And so, so I would say even for a kiddo with CP, that would be a thing that you could look at. I don't know what supplementation, those kinds of things would look like, but, that testing, we do a FRAT test. There's another video you can take a look, and it goes deeper into the testing, but FRAT test looks for potential cerebral folate deficiency of using, folic acid in the brain. And those are our tests. So, we really specialize in regenerative medicine, using stem cells for the thing, whatever's we're working on. In this case, it's autism or, yes, some CP cases. And then the chronic disease side and orthopedic side. Innate, innate. Don't forget about our autism family group. So the support page. So innate autism. I don't remember my name. Autism stem cell. Innate autism stem cell family is right in front of me. I don't remember the name of it. Right? Pay attention, girl. Okay, innate autism stem cell families. Go there on Facebook, look for the group, and you can join, and that you can get more information, communicate with families that are their prospective families, current families. So it's a good place to have conversation there. Fadua, you have Fragile X, developmental delays, ADHD, severe autism. Can we see any results with stem cells? So I think it's just with if you go back.
Somebody replied to it.
If you go back to for good experience with stem cells, yeah. So Fadua, I would say if you just from the rest of what I said, I hopefully that answered your question. That it's just with our kid with Beau's child, where we know it's going to heal things on the inside. We don't know, objectively what that's going to look like on the outside. But when you put multiple things together, multiple different conditions, then that changes how I'm able to say, this is what we typically see. And so the safety is there. Will it heal something? Yes. Could we see some outcomes? Yes. I can't guarantee it, and I can't tell you what they are going to be in this case because there's multiple factors. But if it's something you want to try to see if you can get improvements, then the potential's there.
To have one to take home next time.
Oh yeah, some of the clothing or some sort of gear or something. Okay. So all right. Thank you everyone for your questions. Nailed it. I hope that was helpful. And I hope share this with families that are worried about regression, or maybe you think they could just get some greater understanding of what it means to use stem cells, what it means to see the behavior changes afterwards, that it is not necessarily a bad thing. So share this, like it, I don't know, whatever we do on social media. We do all the thing. Click. Hashtag replay. Hashtag Tuesdays with Dr. Miriam. That's not a thing right now, but guest star Cece. All the things.
Love it.
All right. You're welcome, Wendy. All right. Thank you, guys. See you next Tuesday here between 12 and 12:15 Arizona time on Tuesdays with Dr. Miriam.
And sometimes me.
And sometimes Cece. Whenever Cece comes on. All right. Bye, guys.